Our top focus story this morning, swine flu is penetrating deep into India with the death toll now reaching 668 people. According to the latest figures, more than 10,000 people have been affected due to the H1N1 virus. Rajasthan, Gujarat, Madhya Pradesh are the worst hit states. In Punjab, the death toll has risen to 24 people, while in neighbouring Haryana, the total number of deaths is 17 people. To curb profit mongers from making money, the Delhi government has ordered all private medical labs not to charge more than 4,500 rupees to carry out swine flu tests. The move comes following complaints by several patients that tests are being conducted at exorbitant rates in the city's private labs. But headlines today carried out a reality check at Delhi hospitals. Despite the claims made by the government, the top government hospitals like the Ram Manohar Lohia Hospital, the LNJP Hospital and the Lal Bahadur Shastri Hospital are openly flouting the norms. At Ram Manohar Lohia, patients claim that they are not being tested properly and there is a dearth of masks that are available. The condition at Lal Bahadur Hospital is such that the lab for swine flu testing is shut. The Union Health Minister J.P. Nadda had assured that there is no dearth of medicines and hospitals were equipped to deal with swine flu.
Right from very beginning, day-to-day monitoring is being done, advisories have been given, all supports have been given, all logistic supports have been given. We have been giving them advisory for prevention. We are giving them ample amount of medicines. We are monitoring ourselves. We have found that there are approximately 1 lakh tablets in Delhi in our government hospitals and close to 1 lakh in private hospitals. I would like to appeal to the public that we should not get panicked, but at the same time remain alert.
At RML, patients are complaining that they are not getting complete treatment. People are coming for treatment. They are complaining that they are having to wait for long hours to receive treatment.
यहाँ ज़्यादा ये है कि स्टाफ के आदमी जो आ रहे हैं या वीआईपी कल्चर जो है वो बहुत ज़्यादा यहाँ पर है। जो पहले अभी एक गाड़ी आप देख रहे हो, गवर्नमेंट ऑफ इंडिया की गाड़ी खड़ी है, इसमें ये उतरे और सीधा ये अंदर वहाँ, और आम आदमी लाइन पे खड़ा हुआ है और मरने के लिए तैयार बैठा हुआ है।
हम सुविधाओं की जो हॉस्पिटल में सरकारी मिलनी चाहिए, दवाई, टेस्ट, बाकी सारी चीज़ें, मास्क, ये सब किस तरह से आपको यहाँ पर मिल रहा है?
ये सब परचेज करना पड़ रहा है मैम।
दवाई बाहर से खरीदी आपने?
दवाई कुछ बाहर से है, कुछ यहाँ से भी मिली है।
टेस्ट कहाँ से कराया आपने?
टेस्ट इसी हॉस्पिटल से कराया, लेकिन उसके अंदर 8 दिन डिले हुआ है, जिसमें कि मेरी बच्ची और परेशान हो गई है। H1N1 का जो हमने टेस्ट कराया था वो 11th को कराया था, लेकिन आज हमारे को रिपोर्ट आई है उसकी, इसलिए हम उसको अर्जेंट लेके भागे हैं। अगर ये रिपोर्ट हमारे को 2-3 दिन के अंदर अवेलेबल हो जाती तो हमारा बच्चा शायद पहले से और बेटर कंडीशन में होता।
And my colleague Kamaljeet Kaur Sandhu now joins me live from the national capital. Kamal, despite the health minister coming out and giving all kinds of reassurances, it does appear that the ground reality is quite different.
Well, J.P. Nadda has clearly told people that there is no need to panic, but the situation definitely is otherwise. And whether we've seen cases in Gujarat, whether we start talking about cases in Madhya Pradesh, Rajasthan, the swine flu is eventually spreading to other states, including Jammu and Kashmir. So this is a serious case. This is something that people are going to be talking about. There's already a voice from the opposition party saying that India should have been better prepared. The vaccine should have come in earlier. They also talk about how the entire system has not been prepared, and that is why we've seen more than 600 deaths. Even though the situation in Delhi is slightly better, there are only 6 deaths and more than 1,500 cases reported so far. But the fact remains that people are saying perhaps the situation is under control. There is also verbatim orders coming in from the Aam Aadmi Party saying the lab should not be charging too much. The vaccine should be made available. The medicine should be made available. But on ground situation, the way it seems that the swine flu scare is only spreading. And the fact remains that the central government, who is at the helm of affairs, has been taken meetings, has not been able to contain it.
Well, absolutely. With more than 10,000 people affected, Union Health Minister has come out every day and given all kinds of reassurances. But as Kamal has been pointing out, Headlines Today reporters fanned out across the national capital, top government hospitals in the national capital, and are telling you that the story is quite otherwise. Kamaljeet Kaur Sandhu is going to continue to track developments on this big story for us. Thanks, Kamal, for joining us with that update.